to Insider Medicine in Depth. I'm Dr. Susan Sharma. Two structured weight loss programs for overweight and obese individuals have shown success in research published in the Journal of the American Medical Association. Here are some recommendations for the management of obesity from the American Dietetic Association. Body weight and waist circumference should be used to determine the effectiveness of therapy. Weight loss and weight maintenance therapy should be based on a comprehensive weight management program, including diet, physical activity, and behavioral therapy. Medical nutrition therapy for weight loss should last at least 6 months or until weight loss goals are achieved, with implementation of weight maintenance programs after that time. In the first study, researchers out of the University of Pittsburgh School of Medicine randomly assigned 130 severely obese adults without diabetes to a diet and physical activity intervention or an identical intervention in which physical activity was delayed for 6 months. Physical activity consisted of brisk walking for 60 minutes 5 days a week. The participants received liquid and pre-packaged meal replacements for most of their meals, as well as small financial incentives for reaching specific goals. At the end of the 12-month intervention, both groups had lost a similar amount of weight, although weight loss was initially greater among those who started the physical activity component immediately. Waist circumference, visceral abdominal fat, hepatic fat content, blood pressure, and insulin resistance were all reduced in both groups. In the second study, researchers out of Moore's UCSD Cancer Center randomized 442 overweight and obese women to receive one of 3 weight loss interventions: in-person, weekly one-on-one weight loss counseling, similar counseling but via telephone, or usual care. The women in the first 2 groups also received pre-packaged prepared foods and increased their physical activity for 30 minutes a day, 5 days a week. The usual care group received 2 individualized weight loss counseling sessions with a dietetics professional and monthly contacts. All participants received monetary compensation for successful clinic visits. After 24 months, weight loss was greater in the intervention groups than in the usual care group, and more than half of those in either of the intervention groups lost at least 5% of their body weight, compared with only 29% in the usual care group. Today's research suggests that structured weight loss interventions that include both a dietary and physical activity component, and that make use of free meal replacements and financial incentives, may provide the context and motivation to produce lasting weight loss. For Insider Medicine in Depth, I'm Dr. Susan Sharma.